From a data perspective, how do we help moms navigate the pressure of the ticking clock or the fear of advanced maternal age when they are still trying to emotionally heal from a previous loss?
Welcome to So Glad You Asked, the show where real moms bring us their toughest questions. I'm Dr. Ruta Nonacs, a perinatal psychiatrist at Mass General Hospital with over 30 years of experience supporting the mental health of moms and helping them navigate the emotional highs and lows and the often unexpected challenges that come with planning a family, pregnancy, and motherhood.
And I'm Allie Hales, a mom of 4. I know what it's like to scour the internet, wide awake at 2 a.m. with a million questions, wondering if what I was experiencing was normal. That's why we created this show. It isn't just for real moms, it's by real moms. Every episode is a conversation led by you. Your questions, your experiences, your mental health, front and center.
And we don't just listen. We provide real, evidence-based answers and reliable resources from trusted experts. Because moms don't just deserve support, they deserve solutions.
One thing I often tell Dr. Ruta is that none of my pregnancies and deliveries went the way I expected. From preterm birth and C-sections to feeding challenges and hip dysplasia harnesses and pelvic floor therapy, I never felt fully prepared. And I've come to realize that the uncertainty doesn't end after birth. It often carries forward into parenting, shaping how we make decisions and how we hold both worry and hope at the same time. Even though half of pregnancies involve some type of complication, whether miscarriage, gestational diabetes, preeclampsia, or something else, we often don't talk about these experiences openly. We carry the guilt privately while the world around us expects us to just move on or try again, but there isn't a simple reset button. It's complicated, it's emotional, and often it's filled with uncertainty. For me, the hardest parts of pregnancy and parenting have never been just the complication itself. It has been the uncertainty. The constant question of, am I making the right decision? Whether it was deciding how to feed my babies, sleep training, or even navigating the after-school chaos of older children, I have always sought out accurate, transparent information that can help me make informed decisions. I first discovered Dr. Emily Oster's work right before the COVID pandemic. During a time when there was so much fear and conflicting information, I found myself relying on her data-driven approach again and again. And helped me feel calmer, more grounded, and more confident in the choices I was making for my family. Dr. Emily Oster is a professor of economics at Brown University, founder and CEO of ParentData, author of multiple best-selling books, including The Unexpected, and co-host of the podcast Wellness Actually. She has transformed the way parents think about risk, data, and decision-making. Today, we're focusing on how parents can navigate uncertainty with confidence and make informed decisions that support their mental health. Emily, we are so glad you're here.
Thank you for having me. I'm delighted to be here.
So your newest book, The Unexpected, begins with preparation. And just for the listeners who have not read it yet and who are unfamiliar, what does emotional preparation actually look like when we know that uncertainty is part of the process?
Yeah. So The Unexpected is really about navigating pregnancy after complications, which there's a wide range. About 50% of pregnancies end in or involve some kind of complication. And so this book is really about kind of how do you come into another experience out of that. And part of what we wanted to address in the book, and it's co-written with a maternal fetal medicine specialist, part of what we wanted to address was just the preparation for the details of, what will happen, the question that all of the data-minded people go to, which is what's the chance of it happening again? What can I do to prevent it? But I really believe there's a very important part of sort of emotionally preparing in advance of any of this and asking, how do I understand what happened before? And so we sort of suggest that people ask some questions, what happened? So try to understand the details. Why did it happen to me? And I think that's the really important emotional preparation question, because people do ask that question. They ask, so why did this happen to me? Why was I cut? Why did this terrible thing happen? And Nate, my co-author Nate, and I would really like people to reframe that question as asking, why was there something about my risk set or something about, the way the pregnancy went that made me more likely to have this complication? So rather than why am I at fault here or why was I punished, to ask just how can I frame that question to be practically helpful for then moving on to the more practical questions like, what can I do to prevent this from happening again? What's the chance it would happen again? So I think the emotional preparation part is really sort of trying to transform what's often an experience of just feeling, again, sort of punished or at fault into like, how can I practically prepare myself to move forward?
I think that's great. So my first birth ended up being, it was preterm. And I totally I was like, everything had gone fine until it didn't go fine. And I was, wondering like, well, what did I do? Like, was I exercising too much? Was I like doing this wrong? Like, what happened? And I think going into my second pregnancy, I also had that like emotional, response of it was my fault and I might cause it to happen again. So I appreciate you,
Yeah.
having women take a step back and looking at it like, okay, let's look at what actually happened and what we can do and what we can control and what we can't control. Yeah.
Yeah, and I think that part about what we control and what we can't control is really important because, of course, there are some complications where it is true that there's something, not so much that you did, but a sort of characteristic or some modifiable risk factor. And we could say, okay, is that something we can change? Which is different from saying
Yeah.
it's your fault. But it is, here's something modifiable. And then there are many of these cases where the answer we're going to get to is like, there's really nothing that you did. There's nothing we can control. It just is a thing that happened, and then you can try and move forward
Yeah.
from there.
As a psychiatrist, I just wanted to add something about being able to tolerate uncertainty. Pregnancy and having a child is kind of a huge test in that area. We are learning that being able to tolerate uncertainty is important to resilience and adaptability. From a mental health perspective, being able to tolerate uncertainty is protective. Emily, I first heard your name when my younger brother and sister-in-law got pregnant. They kept talking about Emily Oster and what Emily Oster recommended. My first thought was this: why aren't you discussing this with your doctor? Given the incredible success of your books, we can firmly conclude that just talking to your doctor might not be enough when you're navigating pregnancy and parenting. Why do you think that's the case?
Good question. I think one thing that I would say, I always, especially with pregnancy, I should always think of my work as complementary to your doctor rather than a substitute. I think the biggest issue for many people is just the limited time. So people have a lot of questions, and rightly, when you are there with your doctor, they are focused on like, let me take these measurements. Let me, let me sort of think about the medical pieces of this and the myriad of questions that people have. Can I clean the litter box? What's really the data say about hot dogs? What is this thing about Tylenol? Like what, there sort of isn't time to do all of those things and also do the doctoring stuff. So I think that's kind of one issue. And then I think the other thing is that for the most part, doctors are not trained in like one of the things I think resonates about my work is kind of like, let me really walk you through like why we think some things from data and why data shows some things and doesn't show others. Like how do we really think about causality and evidence? And that's actually just like what I think a lot of people like that approach. Maybe that's surprising, but that's true. And that's the kind of approach that lends itself to the type of training that I have relative to medicine. So it's like, I am trained in how to read causality at adult studies, medical studies, other kind of studies. That's my job. And I think that's kind of the approach that I think resonates with.
100% it resonates. And I like what you said, that it's complementary, because I mean, of course, like, I had some complications with my pregnancies and deliveries. Like, I'm so appreciative of my amazing OB and, going through that experience safely and everything, went as well as it could. But also like trying to make sense of it all. I have turned to your work, and it's been so, appreciated and transformative for me, just being able to like make sense of what happened. And I think another thing that I feel like I hear a lot about, like what my friends ask, I've experienced it too, is, feeling like your OBGYN, your meetings with the OBGYN are quick, and then it's hard to get in touch with them. And it can be really frustrating trying to figure out like, well, do I really bug them with this small question? But then I am wondering like, can I take Tylenol, or can I, whatever all these things are. And you do a great job with your Ask Me Anything. Like I love, and with Dewey on ParentData, like being able to kind of search those like frequently asked questions. But when a woman's feeling like, they need to advocate for themselves and they don't feel like their OBGYN is providing, the information that they need to feel confident making a decision, what do you suggest to women to do in that situation?
Yeah, that's obviously very tough situation. I think there's sort of two pieces. One is the like I don't want to bother them, and then a second is like I don't feel like I'm getting the answers that I want. And I think there's a component of preparation for both of those. You do get pretty limited time with your OB, which means the more one can bring in, like, here are the things I'm thinking about, and like, the more one can understand, like, here are the decisions that are going to come up. Here are the questions I have about those decisions, the more effective those conversations can be. I feel like a lot of my work is about trying to not give people the answers, but give them tools to have those conversations go more efficiently, which is kind of what we need. I think that's one piece of it. I think a second piece of it is figuring out at the beginning of the relationship, what is the expectation for how I'm going to get answers when I need them in the moment, and being very clear about what you need, and is this doctor a good fit for that? Right. So if you are a person who is going to need to like have your anxiety dialed down, which I understand because I am that person, if you're going to need that a lot, you need to have a provider relationship that is in some way to accommodate that, or you're going to be very upset. And so, like, honestly, midwives are like, it's often easier to get in touch with a midwife. If you're going to have a lot of questions and you have a relatively low risk pregnancy, that may be a better kind of option. So I think just really being honest with yourself and your provider about what you need in advance is important. I think the third really hard conversation is one where like your provider's telling you something and you don't think it's right, or you don't think it's consistent with something else you've heard. And those conversations are hard because you never want to start them with, what are you talking about? You're telling me something that's wrong. Partly because they may not be, and partly because that's a terrible way to come into any conversation with another person. So the phrasing I almost always tell people to try to use is something like, my understanding of the data is, bed rest isn't generally recommended for complications. Is there something different about my case that would make you recommend it here? Which is sort of an opening for like, hey, I'm not sure that this is what the data says, but also like acknowledges that there may well be something different about your case that could prompt a different piece of advice. So
no, I love that. And I love how you described, you give the people the tools to then, advocate for themselves and to make informed choices, which I think it's such a wonderful way to go about it. And that, every family situation is different. Everyone's personal preference, et cetera, are, unique. I like what you said too about understanding the data, because I feel like right now it's a unique time where, we are hearing different things from trusted sources, like, CDC or, our own personal doctors. Like when, there was a time where people might have been more in step with each other, like all the different agencies, there are situations now where, they're at odds. And how do you, if you're not going through the data yourself, like how do you know who to trust or where to go for reliable information?
Totally. I mean, I think there's like 17 different problems with misinformation right now. I think one is the problem we've had even before the current administration, which is, when you are just trying to scroll on the internet or whatever, things are coming at you that you're not kind of prepared to evaluate because you're not in a moment of evaluating. I think that always tell people, like, if something comes across your feed or your news feed or whatever it is, and it's not something that's decision relevant for you, try not to think about it. Like, you probably don't need to engage with every panic headline because most of them are not relevant for decisions. Like later, there'll be an opportunity later to engage with that if you are making that decision. So I think we're just really not very good as people. We're never good at decision making if it comes from a place of like, oh my God, I was just trying to scroll cat videos and all of a sudden, like, now I think my kid's gonna die because I put them in daycare. Like, so we're not.
Well, it's funny because you say it like an over exaggeration, but like I feel like I've gone there. Like I've been scrolling through. Yeah,
that's a real thing.
So
that's a real thing. I'm just trying to read. I'm trying to watch my like professional running people like do that, and then all of a sudden there's a thing that's like when you drop your kid at daycare, they think you died. It's like
no.
What?
I was not ready for that.
More of the other algorithm. And then, of course, you get stuck because you're watching. You're like, oh, man, I'm watching this. And then the algorithm's like, you enjoy reels events. I don't enjoy it.
Well, and the other thing I was going to ask you about too is, so you did a segment under Ask Me Anything recently about red light masks, which I 100% bought a red light masks. I'm like, look at all the results. They're amazing. Sure. Like everything,
everybody.
But I think that's another thing with parenting is, you get in a situation where you're trying to solve a problem and then you start Googling stuff or whatever, and then your algorithm comes up with, oh, well, you want to help your baby sleep? Here are like 50 things that you should order to help your baby sleep. Like trying to sort through that just feels...
There is no one more susceptible to marketing than the exhausted new parent. It's just and we're looking for solutions. And I think, unfortunately, there are a lot of cases in which the solution, like maybe there is a solution, but it's just it's not as simple as, purchase this course or purchase this mask or, buy this packet of vitamins or whatever. It's like, here are the things that are hard and here are some ways you can move forward. And I think that doesn't lend itself well to the current information environment. On top of all of this, then you have the kind of CDC now says vaccines are bad. The AAP and the CDC disagree that, there's a lot of, particularly much more so around vaccines than almost anything else. There's this really, really like noisy thing for parents in this moment where they're having a hard time navigating. I would put that almost separate from all of the other things. Like that is a real problem. And I don't really know what to do about it. I actually think what we need to do about it is probably quite different than what we need to do about, how do we get people to interact better with the noise online.
One thing that you've talked about a lot is, you have two choices, like you have an option A and an option B. And there are good things and bad things about both options. And you don't obviously have a, crystal ball and can tell where you're going with either one. And you kind of get, at least for me, like I've gotten paralyzed by wishing for this option C that you've described before. Like even the other day, I was having a difficult situation with my daughter and we were trying to decide between A and B. And I was wishing for that option C. And it was really hard to make a decision between A and B, not feeling like either one was perfect. And, with so many things in parenting, you're making so many decisions. How do you tell parents to pick? You have to pick A or B. There is no C. Like, what's that thought process like? And tell us a little about that.
Yeah. I mean, I think the first thing with good decision making is kind of acknowledging the constraints on the choices that we have and recognizing that if you don't make a choice, the world makes one for you. And so in a sense, like it's not going to make things better to wait. But you're right. It's so challenging to choose something that we know has a downside, right? Like once you sit down, you think about your choices, you're like, I could do this, I could do this. And bad things about both of them. It's so hard to just be like, okay, we're going to choose this, even though we know that it's going to, make our weekends worse in the following way, or my kid's not going to like it, or whatever, whatever it is. Like that choice is just really hard to make. I think it's crucial for people to you almost have to force a choice. So I would tell people in sort of good decision making, you pick the choices, you get the information, and then you need to say like, this is the time we're going to make the decision. Like, I don't know what we're going to sit down, we're going to have a meeting. At the end of the meeting, we're going to have a decision coming out of the meeting, and then we're going to implement the decision. Like there's a sort of forced choice there. And it is facilitated by recognizing that there's no secret option C. And that if you wait and wait and wait, some decision will be made for you. I think the hardest of these choices for people, I think, is when there's many hard choices. One very hard choice it comes up for people all the time is like, I want to have another kid and my partner doesn't. And it's sort of, people are like, how do we solve this? And it's like, listen, like there's no half a baby. Like you're either going to have another one or you're not. And if you wait and wait and wait, you're not. Right. That's like waiting and not deciding is choosing for you. And you really need to force that by recognizing that at the other side of that, someone's not going to have gotten the thing they want. And good decision making is about figuring out, how are we going to sort of make it as right as possible, recognizing that like there's just no way to have both of those things at the same time.
Yeah. So another question we had was, you've spent your career looking at the data and the numbers and, all these different studies. And there is this gap between how common pregnancy complications are or issues that happen and how isolated women feel when it happens to them. And it's just interesting given, 50% of pregnancies have some kind of complication. And yet, at least for me, a lot of times it felt like, well, I don't even know anyone else that's experiencing what I've experienced. Like what happened, just where you feel like that disconnect is, or like why that's there.
Yeah, I mean, I think there's a few pieces of this. Like, one is almost like the sort of shame aspect, and in a lot of there's a sort of secrecy, and then there's a shit like this thing happened, but I don't really want to talk about it. Other people maybe don't hear about it, and so you feel like, okay, I'm not interested in kind of sharing this with people because maybe they'll be uncomfortable in some way, and I think there's all of those reasons keep this kind of quiet. The cost of that is a feeling of loneliness and confusion, and it happens in pregnancy, but it also happens in some of the sort of things that happen after. I was thinking this yesterday because somebody asked somebody. So I do these Wednesday Q&As on Instagram, and somebody said, whenever I start breastfeeding, I feel like intense self-hatred and disgust. How do I, what's going on? What's wrong with me? The thing is, there is a thing called dysmorphic milk ejection reflex, which is surprisingly common.
I've never
At
heard of
least
that, but that's making sense. Yeah.
messages that I like. And so there's a thing. So I said, hey, this is the thing you have. There is for some women during letdown, they have a surge of hormones, and it prompts a lot of feelings, some of which are very negative, intense depression, it's a very can be a very overwhelming feeling. This person has never heard of that, but I promise that when she, Googles support group DNER, she is going to find all of the other people who are in my DMs who are like, I had that. And that's an example where somebody is feeling really terrible every time they start breastfeeding, which when you have a baby is not infrequent, and not getting the help they need. And so I think that kind of thing is so much the cost of not being public about it, not making it clear to people, what's going on behind the scenes.
Yeah, totally. Another question we had was, when do you feel like data reaches its limit? Like we've, gotten the data and we still aren't sure. At what point are we, do you have a?
Yeah. Almost all the time. I mean, I think so. One of the things I will often tell people is, the data is not boxy. So when you make a decision, it is very rare that the data is going to be so clear in one direction or the other that it's going to say this is definitely the decision you must make. Is a couple of examples in parenting where it's boy, it's really overwhelming that this is the right choice, but they're few and far between. Most of the time, the data is one input along with your preferences or other constraints into a good decision. So thinking about data as kind of there's data and there's preferences, and you need to combine them to make the right choice for you is going to be much more productive than thinking, as sometimes people do, about sort of data and your gut feeling. And people will put those against each other. Well, should I go with the data or should I go with my gut? It's well, the answer is you should go with both. Because when you say gut feeling, what you mean is preference. You mean I feel this thing is really right for me. That's great. You should listen to that. And also you should look at the data because those things need to work together, not as two different ways to make decisions. There's only one good way to make decisions, but you need both pieces of it.
Also, something I tell my patients when they're going through difficult decision-making processes, I tell them to ask their healthcare provider to say, if this was your partner, or if this was your daughter, or if this is your mother, what would you do? Because I do think there is the data, and I think there's another layer of clinical experience that sometimes doesn't align with the data. And I think getting a physician or another healthcare provider to sort of take a stand can be difficult, but sometimes it can be a very helpful piece of information.
I think too, what you're saying about, your gut feeling versus the data and how you reconcile both of those things. I'm sure, there's situations where you're kind of overriding your instinct a little bit more because you see the data. And then there's also times when you're seeing the data, but then you're giving more weight to your instincts. So I think that is at least for me with formula feeding, data, my mental health, everything told me you need to make this switch. It's going to be the best thing for you. But then emotionally, I was so torn up about it. And I ended up, overriding that emotional sense, knowing that what my choice was safe and everything would be fine. But I think what you're saying with that, like, kind of give and take, it's complicated, but you're right. Like, you have to have both. So,
Yeah, and I think you have to sometimes in our decisions, it sort of goes back to like when both options are not great. Like sometimes our decisions require us to sit in the end with like, I wish this had been different, right? Sort of like for you to say like, I wish breastfeeding had been super easy and fun. Like that's what I was hoping for coming into this was like breastfeeding is super easy and fun and I love it. It makes me go great. But well, you didn't get that. And like there's grief. You could just say like, I'm grieving the loss of not the loss of breastfeeding, but the loss of like the way that I imagined that it was. And that's a totally valid, reasonable way to feel while also making whatever is the right decision, given the constraints that you have been handed, which for many of us is like breastfeeding is not that fun and really hard and doesn't really work all the time. No, it can be great. Again, it can be great. It's not always great.
no, that's helpful.
And that your comment also gets to something that I often see is that there are things we call complications. I see these patients who have had, quote, uncomplicated pregnancies, but so many things have gone wrong or not the way they expected. And they feel like, well, I shouldn't be upset.
Yeah. No, and people will say, well, I had like, fourth degree vaginal tearing, but, and people are like, well, baby was fine. It's like, but actually that's like a very traumatic event that takes a long time to recover from. And we shouldn't, minimize them. And I think I totally agree with you, Ruta, the like labeling of things as like, well, this is a bad thing. And this is like kind of, well, you should just be getting over it, does not acknowledge differences across people, among other problems.
It's so powerful to hear that so much of the guilt we carry as parents isn't backed by evidence, it's backed by uncertainty. The truth is, uncertainty doesn't go away after pregnancy. It continues through parenting, from feeding and sleep to school decisions and beyond. So now we're going to shift our conversation from the big picture of risk and preparation to the day-to-day reality of navigating uncertainty in real time. We're diving into our listener inbox to talk about how to move forward when there are no perfect answers. So we have a written question. How can I manage the paralyzing anxiety of a future pregnancy after experiencing a miscarriage and birth trauma? Every scan feels like a death sentence until proven otherwise.
Yeah. I mean, I think, first of all, I think just acknowledging that is extremely common and there isn't going to be a, like, here's how you fix this problem. I think the two things there are, one, talking to your provider about, is there a cadence of scanning or some other thing that could actually alleviate the anxiety? I think providers are understandably reluctant to do more of that, but also your anxiety is actually something that needs to be treated. So again, going back to like find somebody who's going to work with you on this. That's a big piece of this. And I think the second is just, Nate talks about radical acceptance some in our book, just accepting like this is going to be hard and you are going to live with both the grief and the joy at the same time. And there is no getting around accepting that bad things happened and then trying to move forward anyway.
So here's another question. What is one practical tool parents can use when the what ifs about the future start to spiral?
One practical tool when you are starting to spiral is to ask yourself, do I need to worry about this right now? And usually the answer is no. There's a tool in general in anxiety that I use a lot with my kids, which is to say, like, if you're really struggling with a lot of this, to kind of like compartmentalize it in another time, say like, here's a time in the day I'm going to worry about this, or here's a time in the week we're going to worry about this. We have a lot of concerns about our kids. Great. Let's keep an agenda and let's put a meeting on where we can have a time where we talk about all of our concerns. And then, when something comes up, put it on the list. And so then you sort of give your brain the feeling of like, okay, I've done something about this, without giving your brain the kind of, now I'm going to just like go down a rabbit hole of obsession. So a lot of this is about this kind of CBT of like just moving the worry to another time.
And that's something we use a lot with like patients who have generalized anxiety or OCD and who are waking up in the middle of the night with these questions. We tell them, and it doesn't always work, write it down. We'll take a look at it in the morning because they do keep people up at night.
Middle of the night is a terrible time to think about.
It is.
Ever.
There's another question. There's so much advice about pregnancy online. How can I tell if the information is accurate, evidence-based, and worth trusting?
I would choose your sources in advance. It's rare that there's a random source that comes across your online experience that is something that you necessarily want to listen to. So I think a lot of this is about saying, here are the sources I'm going to listen to. And, I'm going to try not to just listen to stuff that comes across my feed just because it's scary. I think it's also really always worth asking, what's the person selling? A lot of this stuff is like, what they're selling is fear, then the other side of that is a supplement. Or they're selling is fear, and the other side of that is a course, or is it this or that. And so I think, incentives matter.
From a data perspective, how do we help moms navigate the pressure of the ticking clock or the fear of advanced maternal age when they're still trying to get over and emotionally heal from a previous loss or unexpected event?
That is very hard. I think that, there's a kind of honesty combined with understanding that is challenging. I suspect is very challenging to navigate. Because on the one hand, I don't think it's appropriate to tell people like, well, don't worry about it. Age doesn't matter, because age does matter. It's probably one of our most important things. But at the same time, if you're not emotionally ready for this, you're not emotionally ready. And that is what it is. I often wonder whether there's an opportunity in that intermediate space to do as much as we can to sort of set people up for success when they are ready to try. So particularly for older people saying, hey, like, what about doing some cycle tracking? What about doing some sperm testing? Like, how can we sort of get into a place where when you do start to try, you're as prepared as possible for it to move as quickly as it can? Which may be a little bit of an intermediate, like it's productive, but it doesn't force something before someone is ready for it.
I think that's a really good suggestion. And often I see patients who are trying to get pregnant and nothing's happening, and they don't actually know how long it takes to get all of these appointments set up and to do all these testing. So giving them something to do while they're getting ready that feels purposeful and concrete, I think is actually really helpful.
Yeah, people would like something to do, and I think that is when we can give them something that feels like it's moving forward, that really can be emotionally beneficial.
Economists are really good at presenting data and understanding where it comes from, and I love a lot of the discussions you've had with Babu Jena about understanding data and how can doctors get better at presenting data.
But yeah, that's a good question. I mean, I would like to see more data training in med school. So it's something I think is missing from a lot of the med school curricula, is just a deeper understanding of, what makes quality evidence. And in particular, we know, like, most doctors are familiar with, like, there's a large randomized trial of, labor induction. Like, okay, we get that. Like, people can read that. That's great. I think that kind of like, here's a more nuanced take. Maybe it's causal, maybe it's not. That's much harder. That's not really part of the training. And I think there should be more of that in med school. There's a second thing, which is like, how do I communicate data to people? I actually think that's very hard to teach, and is something that one learns mostly with practice and sort of thinking about what are the kinds of messaging that can resonate with people and help them make decisions. How do I explain small probabilities? This is like a thing I think about all the time, and I'm not sure there's like a simple piece of advice. Part of these different people, I spend like a lot of time explaining the same thing 15 different ways, hoping that one of them will hit for any given person.
I think that's true. We get no instruction in medical school about, really how to navigate this large bolus of data that we're getting. And I also think, like with pregnancy and postpartum, there are so few randomized controlled trials. You can't make pregnant women do something and test the option of not doing something. So a lot of the information we get are these naturalistic studies, and we have to think about, breastfeeding is an important one. The women who can breastfeed are often ones with more family support and more time, and we just can't compare that and outcomes to women who don't have those things. But you can't force people to breastfeed.
Right. Yes. But I think that's a good example where actually there is some better data. And I think, learning like here is like some better, within this space, here's a kind of better approach to this. And then having people focus on it would be beneficial.
And I know we're up against time, but one of the things I appreciate about your book as like a sleep deprived parent or as like a busy parent now with young kids, like I love that you include a bottom line at the end of every chapter. So if I've like just, it's been a minute since I just look at the bottom line like, okay, perfect. So as we're wrapping up here, I just was wondering if we could get your bottom line on your advice to parents as they navigate the unexpected.
Okay, my bottom line is recognize you will have to live with some uncertainty and there is no getting around that. Structure your decisions so they force you to make choices that are hard. And remember that this is hard and give yourself a break.
Love it.
Very wise.
Always.
Thank you guys. This is a treat.
Oh, it was amazing for us, Emily. You're just the greatest. Again, all that you've done for me like over the years, I just appreciate it. It's really made parenting much more manageable for me and making my decisions. So really appreciative of all the work you do.
Thank you. Thank you both.
Thank you, Emily.
If you're listening and feeling overwhelmed by uncertainty right now, please know this: you're not alone. Whether you are navigating a complication, grieving a loss, or facing a difficult decision, your emotions are valid. As Emily shared today, the data can guide us, but it doesn't remove the human experience. What it can do is help us to make informed, thoughtful decisions that align with our values and support our mental health. You are not expected to have all the answers. You are allowed to move forward one step at a time, and the fact that you are asking these questions and weighing your options means that you are already a thoughtful and deeply caring parent. Thanks for tuning in. As a reminder, please note that this podcast is not intended to be a substitute for professional medical care. The views, thoughts, and opinions shared today are the speaker's own. Your feedback and questions drive this show, so feel free to send us an email at podcast@womensmentalhealth.org or leave a voicemail at 617-643-9232.
You can find additional resources at our resource hub at sogladyouasked.org. This show is executive produced by Dr. Lee Cohen, produced by Mike Brown and Perry Barrist, and edited by Mike Brown. This is So Glad You Asked with Dr. Ruta Nonacs and Allie Hales, brought to you by the MGH Center for Women's Mental Health and the J. Willard and Alice S. Merritt Foundation. Listen and subscribe wherever you get your podcasts.